Today we're talking with Dr. Nick Bruns, who's an optometrist at Summit Eye Care in Milwaukee, Wisconsin. Hi, Nick. Good to meet you, and thanks for taking the time to join me today.
Yeah, thanks for having me, Eric. This is great.
Yeah, you bet. We were just chatting about how most of the time on this show, we're talking with other owners of independent practices, and you're actually not that, or at least maybe not that yet, anyways, owner of your own practice, but you're the director of practice development there at Summit Eye Care, right? I thought you'd have perhaps some interesting perspectives for our users because you're still, at the end of the day, growing a practice. It's not exactly the same as some of our other listeners, but there'll be some out there who can relate to your story, even if it's indirectly. I think a lot of people will relate to it indirectly as well as direct. So talk to us about that in terms of what your role involves there at the clinic and how it's grown, or maybe even some things you've done to grow it since your time in that position.
We started our clinic cold. So we're in Milwaukee, Wisconsin. We started our clinic cold in January of 2020. If you think back about your timeline, something pretty big happened a couple months after that. And so that was I can't overstate this enough. It was a great time to start a practice, obviously. We were excited to go. So we had 2 months under our belt, and Dr. Vukic is my clinic partner. He has some roots in Milwaukee, but not a lot. The first 2 months, we were really just trying to figure out what we wanted to do. We were trying to build this image of what we wanted the clinic to be. And so, no, I don't have a vested interest in the practice right now. I mean, that's a conversation hopefully down the road that we get into. But right now, as the director of practice development, my big job is to really establish relationships with the doctors in the community, optometrists and ophthalmologists in Milwaukee and the greater Milwaukee area. Because what we do here at Summit Eye Care is mainly surgical. We try to bring in the latest technology, really trying to stay cutting edge, something that we felt Milwaukee was missing. We thought maybe the clinics in Milwaukee, they do a great job, great surgery, but we thought that there was something that we could provide that in the Midwest, we don't always get the latest and greatest. Things start from the coast and they kind of work inward, and Milwaukee tends to be the last. It just seems like it's always the last one. Mm-hmm. And so January 2020, I met Dr. Vukic. I've been connected with him for months before that. We had gotten to know each other quite well. And before I decided to make the move from Michigan, so I'm not originally from Wisconsin, I'm from Michigan, but he told me that he's looking for a medically minded optometrist, somebody that has maybe a little bit more of an extroverted side and is willing to develop relationships and really set roots. And I thought at the time, that's something I think I can do. I think I have the mindset of somebody. I'm a naturally ambitious person. I'm extroverted, and I like numbers too. I'm a math guy, and cataract refractive surgery is all math. It's all numbers. And so you take all these different aspects of what my job has become, you put them together, and it's my ideal day to day. We've developed this practice and built it in the way that we both came from clinics that we thought could be doing better. They're both great clinics. I came from Michigan. He came from Madison, Wisconsin, about an hour from here. And they were both fantastic clinics. I've got nothing but positive to say, but we thought maybe there's things that we could do a little bit better, maybe a little bit more of a personal touch, and do them with a kind of a skew towards more advanced technology. And that's what we did. So it was a terrifying time because the world shut down in March of 2020. And we almost had our skis, or we were almost skiing out in front of our tips just a little bit. We realized that at time where the world shut down, we had some time to go back to the drawing board a little bit and develop a website. For instance, we didn't have a website at the time, and start doing a lot of lunch and dinner meetings and really getting to know the doctors that were in our area a little bit more, maybe on a different level, because they had time, we had time. And so we were doing it safely, obviously with social distancing, but we were really trying to get out in front of people that we knew that we were going to be working with so we could get to know them, because if we know them well, we know their patients and we have better improved ability to take care of their patients. So yeah, that's 4 years ago, 4.5 years, almost 5 years ago. Holy cow! Now, ever since then, I mean, we have been rolling. I think we've built something that every year we've had growth, surgical growth, as well as a big part of our practice is premium cataract surgery, as well as LASIK and elective refractive surgery. And so that is something that has just grown tremendously. And so my other clinical role is really handling a lot of the surgical planning as well as the post-op. So as an optometrist, I have a little bit more of a unique perspective because I've worked my entire career in ophthalmology. I don't do glasses. I don't really do contact lenses. That's not really my niche. My niche is surgical. So I wanted to get as close to the operating room as I possibly could in my field without actually going in. And I think I've kind of figured that out. And Dr. Vukic and I work as a total team. So it's been a blast the last few years.
Yeah, no, it sounds like it. And I didn't realize you had in our pre-chat that you'd been there since the literal start of the practice, it sounds like, right? Yeah.
Yep.
So you guys didn't have your crystal ball out like anybody else in January of 2020?
No,
Yeah, no,
no,
nobody knew what was coming up.
oh man, we thought we had made the biggest mistake of our entire life. My wife and I together, we were like, did we just give up we both had good jobs in Michigan. We were both happy.
Yeah.
We just thought we'd take a little bit of a risk. We are being, I guess, spontaneous. I don't know. It seemed like the right time. And yeah, that was pretty scary, but we kept our nose down. And I guess from my perspective, we had to make it work.
Hmm.
The time where the clinic was closed, I really put my nose down. I feel like I grinded pretty hard to figure out exactly what we needed, how we needed to communicate better to the doctors in Milwaukee, how we designing the website, how we market, and just internal protocols to do better patient management. And I didn't have a choice. If it doesn't work,
Hmm.
well, then we moved. We made this big move for nothing. It was an interesting time, but I'm glad it worked out okay.
Yeah, for sure. For sure. So this was interesting. You had mentioned that you and your wife, well, because you moved from Michigan to Milwaukee, yeah, and you were mentioning that your wife is also an optometrist. So you can talk a little bit about that because she was working for somebody else at the time, and so you guys both left jobs and are coming to Milwaukee to start this new venture. And then what happened from there? So yeah, what does she do now?
So she's an optometrist still. So she graduated a year behind me. She was in a clinic in the central part of the Lower Peninsula, or the Lower Peninsula of Michigan, in the similar area that I was. For her clinic, she just didn't feel like it was a final home for her. She didn't think that it was going to be a long-term opportunity. So there was an end date at some point for that anyways. And so this opportunity for me to take this position came at a pretty convenient time for her. She just knew that the end was coming. And so she moved, obviously we moved together, and she didn't have a final position set up yet. She ended up working in commercial for a few months until she then joined a private clinic, which is much more her career goals. We found a house. We came to Milwaukee in early 2019 or mid 2019 looking at houses. We had a weekend that we were just bouncing around trying to pick a spot to live, and we found one that we loved. And it just so happened to be owned by a retiring ophthalmologist, which we found out through our now neighbor. He was out raking leaves, and he's like, he's an eye doctor too. And we're like, oh, interesting. Okay. And we knew that there was other people looking at the house. So we did what any young couple would do. We wrote a really sappy letter. So we wrote a letter to Dr. Brown, and we just said we love his house. We could see ourselves raising our family there. And he bid on it pretty hard, which was great. and we developed a relationship with him. And he's just a really great guy. And he hadn't been doing surgery for probably 3 or 4 years. He was really practicing medical optometry. I mean, he did his own refractions. He didn't even do any laser procedures. He was doing a lot of glaucoma management, a lot of macular degeneration, just non-surgical or non-injection treatments, and really heavy medical optometry, just not surgical anymore. And he ended up coming back. He gave me a phone call probably about a year after we moved. So this would have been maybe late 2020, early 2021. And he called me and said, hey, Nick, I'm really looking to hang it up. I don't think I want to practice anymore. I've had a great career. He practiced for over 35 years, and I believe over 30 of them in the same clinic that he had built in our home, in the town that we live in now. And he said, do you want to buy the place? And I was, I'm not really at the point. I'm actively involved with Summit, and we are in the very big growth phase. I thought maybe that's something that we could take on. Maybe not. Maybe we're not ready for that yet because we were still trying to figure out our identity. And I brought it to my wife, Elise, and I said, hey, Dr. Brown wants to sell the practice. And that's something that she had always wanted to do. She always wanted to get into private practice and be an owner. She ended up buying the practice. Now she has 2 business partners, and so they together have the practice, and she's the primary owner and primary doctor at the clinic right now. And so she's taken what he had built, and now she manages a lot of medical disease as well. And it's unique because she sends patients to us, obviously. She's got a pretty good referral source. And I like to think it's non-biased. She thinks that we do good work, but she sends patients to us so they get to see the husband and wife dynamic, which is a lot of fun.
Yeah, no, that's great. And I think it's fairly fascinating that you both, in different spots in your career, make this big move without necessarily, you had prospects, but they weren't essentially well established at the time that you were looking into all this, right? So you were taking a big leap. And like you said earlier, whatever life or the world threw at you, you knew you had to make it work. And then you've come out on the other side, both of you have come out on the other side and persevered with that and continued to grow, I presume. Yeah.
Yeah. Oh, yeah.
So
Life
that's
gives you
awesome.
lemon. You got to make lemonade sometimes. I think
There you
we've done more than that.
go. Yeah,
2 kids
yeah.
later, too. And yep, we still live in the same house, growing family. Yeah. And a dog.
Oh, nice.
Yeah.
Very good. I noticed, or I heard you say something earlier about, you were talking about finding your identity in Summit Eye Care, you guys together, and trying to figure out what does that look like? What sets you guys apart from any other provider? Can you get into that a little bit? Because I think, again, there's probably some good lessons in there about just differentiating, whether we're talking to an ophthalmologist or even somebody who does an OD who does comprehensive exams primarily, and everything in between or even outside of those spectrums that you can think of, because differentiating in professional services is sometimes really hard to do. The work is the work, right? Like diseases, it maybe evolve or change, treatment plans change, but the work is the work, right? How do you guys differentiate yourselves?
Well, there's really no secret sauce, I think. When it comes down to patient care, the golden rule, you treat somebody the way you want to be treated. I think what we do offer is definitely high tech. We have some pretty fancy things here. And in cataract and refractive surgery, a lot of what we're trying to, I don't like to use the word sell. We're not trying to sell. There's never a push. But what we're trying to offer is a lifestyle choice for patients. Cataract surgery, there's really no such thing as a non-refractive cataract surgery anymore. Patients come in, what we're doing is not your grandmother's cataract surgery. We're doing it very quick, safe, effective, and predictable. And patients come in with a level of an expectation. They come to us with, I want to get out of glasses as much as possible. I want to go back to playing golf the way I used to be able to. I want to see my ball, or I want to be able to fly my plane, or I just want to be able to see my grandkids, or I want to be able to do my crosswords without glasses on. If it's the level of glasses, contact lens independence that we kind of have made our bread and butter. We're trying to get patients their eyes back to the way they were when they were in their 20s and 30s. And that's easier said than done. But I think what we definitely can do, and what I pride myself in the ability to do, is provide options. I want to make sure my patients are as well educated as possible. The internet is a terrifying place. You can look up anything. If you want to find bad things about cataract surgery, you can find it. Obviously, you can find people who have died from cataract surgery. Does it happen often? No, it certainly doesn't. Cataract surgery is a very simple thing. And so I think what both Dr. Vukic, myself, and then our other two colleagues that work with us, we do is really provide that added white glove treatment where we're treating people how we want to, or how we would like to be treated. And we've all been patients at a doctor's office. You know what it's like, especially going into a surgical procedure, what that's like. You're in an extremely vulnerable spot. You don't know anything about it. And you're putting all the trust in your world. This is your sight. If things go wrong, you could go blind. And so you're putting that trust in me and Dr. Vukic and our entire team. So I want to make sure that you got 100% of our effort. And that's something I think that we do a really good job of. And that's really how we've tried to design the practice. We have good staff. Our staff is fantastic. And it truly is a team effort. And I say that, it almost sounds cliche. I feel like I say it so many times when I talk to other doctors. It's a team effort. I'm a part of the team. Dr. Vukic is part of the team. Our front desk is part of the team. The techs are part of the team. The patient is a part of the team, as well as their entire cohort, their family members, their referring doctors. I mean, there's a dozen people involved in surgical planning. And if not one of those people is on board, we don't have a plan, and we don't have a very effective plan. So the more that we are all aligned, we take our time. We really don't push people through. We try not to be a cataract mill. Everybody knows clinics like that where you're just getting 100 people through the door, you're slicing and dicing, and then you get them out of there, and then they're gone forever. Patients that come, and at least I hope they have the feeling that they have a positive experience, and then they can look back on their cataract surgery with really fond memories. It wasn't a scary time. It wasn't, oh, I didn't know what was going to happen. I was so nervous. I hope they feel calm, and I hope they get the outcome that they want. And that's really what we're trying to do. And I think we've done a good job of that.
Oh, that's awesome. So what I'm hearing a lot of throughout there is in broad strokes. You did a very great job of going through it all, but just like my takeaways from that, if I wanted to take it and apply it as a business lesson, as much so as working in an ophthalmologist clinic, which I do not, but so for the broader business lessons there, like I said, no secret sauce. It is building relationships with your patients, educating and informing them, and really, because this is such a big deal for them, and like you said, because there are horror stories that exist out there for somebody researching for themselves, really educating them to the point that they're confident that they're making a good decision, and they're calm to be able to get over that hump of the fear that comes along with a lot of medical procedures, right? Or a
Mhm.
lot of things that we do to better ourselves comes along with this uncertainty and fear. And so that if we kind of work to erase that through facts and data and the relationship, that they can make good decisions for themselves, depending on if they want to go through with it or not. And their experience is going to be really heightened because of that process. Yeah.
Yeah, and I think everybody processes information differently too. So I think our website we've done a really good job with that. I think that's the easiest thing that anybody can do when you're building a clinic is have a really good website. It's got to reflect you because that's the first thing that patients are going to look at. So on our website, we've done a lot of video work. Dr. Vukic and myself, we have a lot of little short videos about what is cataract surgery, right? What is, for us, we do a lot of work with the light adjustable lens. What is that? And how is it different than the alternative? And there's even been times both Dr. Vukic and myself lecture quite a bit. And we do symposia for doctors in the area. And we've actually recorded some of these lectures before because some patients really like to get deep into it. They like the data, they like the doctor lingo. At least they think they know what we're talking about. They may not, but they like to
Sure.
hear that we know what we're talking about. So we've actually
Yeah.
recorded some lectures too, or roundtable discussions where the two of us among different doctors are talking at a really high level about certain new technologies that our patients have found. One thing that we did a couple years ago, we did a roundtable on the light adjustable lens. We were two surgeons. This is surgeon talk. And we had it recorded, and we were going to use this to educate our referral network. If you want to look into it, here it is, the information, and this is straight from our mouth. This is all data. Nothing is 100% in the surgical world, but this is data. This is FDA trials and everything. We put it on YouTube and we found that there was well over 40,000 people that have viewed that now. And that's not
Wow.
doctors, that's patients that have found it. So putting yourself in a position to educate, I think, has helped us quite a bit too. And
Mhm.
patients like hearing that. I think, don't BS a BSer. I think patients really are more educated than you think sometimes.
Yeah.
And trying to not sell, you want to give them actual raw, good data for them to make an educated decision. That's a big part of what we've tried to do.
For sure. Very good. Hey, look, I know we're running up close on time. I got a couple of things though that I still wanted to ask you here. In terms of maybe you've already touched on some of these, but other than COVID-19, I don't know if there is one, but what has been some of the toughest challenges that you guys face at Summit Eye Care, growing from a cold start, germ of an idea of how you wanted to position the practice to where you're at today? Is there another like toughest challenge that you had faced kind of bringing those ideas into reality?
I think the simple challenge is staffing is always hard. I think in
Mm,
any medical world, staffing is always difficult. We've got a really good core group right now that I think works really well, but we've had people along the way that haven't been good fits. Not that they're not intelligent, not that they're not capable. It's just the personalities didn't mesh with what we're trying to portray. And so that's a challenge, and it will always be a challenge. People come and go. There's certain things you can train. You can train somebody how to do tests and how to ask the right questions, but you can't always train attitude. And that's the first thing we look at when we hire new people is, do you have the ability to hold a conversation and just be nice? Again, the golden rule, you got to treat somebody like you want to be treated. And if you can't do that, then it's just not a good fit.
yeah.
I think the second thing is integrating ourselves into a system of, not a system, but a community of doctors that already has been practicing for decades and centuries. We are a brand
Mm,
new face. We do cataract surgery, but there's other cataract surgeons in the area. And so trying to educate the optometrists that refer to us about what makes us different. And sometimes it's hard to get in front of them because they've got practice patterns and they've been doing that for a long time. And you can't just come and expect people to jump on board because you've got shiny new equipment. It doesn't work that way. You have to sell yourself a little bit. And that was a challenge for me to really put myself out there and be okay with somebody saying no. They may not want to work with us. They may not want to take the lunch meeting, and that you can't take things personally. They've just got something that works for them, and that's fine. That's totally fine. So you're not going to make friends with everybody. Hopefully, didn't make any enemies, but we're not best friends with everybody in the area, and that's okay too. And it's a pretty big sandbox. There's plenty of room to play.
yeah, very good. That's the title of the show, and that's the mentality we all have too, right? With
Yeah.
being abundant ODs and abundance in our business and personal lives at the core level is just that, what you just said. There's enough around there for everybody. It's part of it, a big part of it. You may not capture it all, but you've been successful in what you have been doing and growing it. That says a lot about how it's just not right for everybody, but you're right for the right people, hopefully, that will allow you to continue on and keep growing and prospering, right?
Yeah.
And again, the last thing I'll ask you, Nick, is, and he may have already hit on it as well. And if you have, that's fine. Maybe it's worth restating
Sure.
for sure. Is just a piece of advice you give to others on their journey, growing their practice and putting themselves out there. What's your like best piece of advice you can give?
Yeah, so I think the best piece of advice is don't be afraid of a little hard work. It is not going to be smooth sailing. As you build a practice, again, you got to find where you fit and how you fit in, but there is a fit. You just need to figure it out. So don't be afraid of the hard work and don't be afraid to specialize a little bit. Optometry is such a beautiful field because there's so many things you can do with it. Back 40, 50 years ago, optometrists were doing mostly just glasses and contact lenses. There was not a lot of medical stuff, and you really couldn't even use TPAs or DPAs. And fast forward to today, I haven't touched a contact lens in years. And it's because I don't have to. And it's something that I didn't really want to do. So you don't have to go into optometry with a preconceived idea of what optometry is, because it might be completely different than what you expect. I thought optometry was a lot of glasses and contacts when I got into school. And I knew it was kind of medical adjacent, but I didn't realize how much medicine it really was. But no, really, optometry is extremely medical. I mean, we're managing systemic disease all the time. We're managing ocular manifestations of systemic disease, but I'm coordinating care with primary care doctors, subspecialists, surgeons, all sorts of people, as well as managing ocular surgery day to day. And so don't be afraid to subspecialize. In fact, I'd encourage you to subspecialize just a little bit, because I think that's where optometry is probably going towards as well. Year after year, you're seeing the same number of ophthalmologists coming out of residency, but the number of optometrists and our aging population is growing. So there's going to be a gap of patients that will need medical eye care and medical management of disease. So specializing at least a little bit is a pretty easy way to get your feet under you as you develop your practice and really determine what your practice identity is, because that's going to be a need that's going to be more and more moving forward in the coming years to decades.
Perfect. Nick, thank you so much for your time today. You've shared a lot and just have enjoyed the conversation and got some good takeaways out of it as well. So appreciate your time, and hopefully our paths will cross again soon. But take care and have a great rest of your day.
Awesome. Thanks a lot, Eric. Appreciate it. Thanks for having me on.
You bet.